Hi, in this video we're going to talk about our post-operative instructions after your hair transplant. So let's discuss what we need to do to get a successful result. Hi, welcome back to the channel. So this video is designed for our patients who had a hair transplant procedure done by us. It just tells you what to do after the transplant. You will have received a set of post-op instructions with your post-operative kit. It has papers with all the written down instructions that I'm going to discuss here. But I figured this is good because you can access it during, multiple times during your post-op period, and you can review it if you need to. So if you had surgery with someone else, then use your judgment and follow your doctor's instructions. Obviously, this is for my patients, but it's a general guideline anyway. So use it if you had surgery by someone else, just use it at your discretion. But I would recommend that you follow the instructions of your doctor, okay? So for my patients, we start the post-op instructions the day after you leave the procedure. So these are all designed to make you heal well, make you heal comfortably. As you know by now, I'm very keen on having not only a great experience here during the surgery, making sure that you're comfortable, that you have some sleep, that you have lunch, that you have all these things that we go out of our way to provide for you. So with that experience, now you get home and you start taking care of it. So my goal is for you to actually also have a very comfortable post-operative course. And of course, that'll result into a safe healing and a very timely healing, going back to normal activities quicker without any complications, and also a successful result, which is what you and I, of course, want at the end of this, okay? So when you leave the office the day of the procedure, you're gonna have a little bandana covering the transplanted area. So you're gonna leave that on until the next day. Do not do anything with the bandage that we apply on. It's a very light bandage. What I want you to do once you get home and get situated is start hydrating yourself, okay? As a surgeon, I know that hydration, both before surgery and after surgery, is one of the main predictors and the most important factors on a successful surgical outcome. Of course, the surgery for hair transplant is very safe and all that, but it's important because you have to keep your body hydrated. You have the medications that I gave you here in the office still circulating through your system for the rest of that day. And so you want to make sure that you flush them out and that your kidneys are working well and that you hydrate, okay? So that's very important. You can use anything, you can drink anything. The only restriction is no alcohol that day particularly, because I gave you some medications that do not go well with alcohol. So Gatorade is okay, water, soda, anything you like, but no alcohol, okay? Second thing is, later in the day, once you get home, of course you had lunch with us here. And so when you get home, make sure you eat a light meal for dinner or a snack or something like that. You don't want to skip that because, of course, again, you're rehealing from a procedure and your body needs sustenance, needs to be fed, right? So you want to make sure that you have a meal. Sometimes you may feel a little queasy because of all the medications you took here. So you may not go for like a heavy meal, but try to include some protein, maybe some chicken or even some steak or pork, whatever, maybe a salad, maybe some fruit. Things that are light, that are not going to weigh so heavy in your stomach, that are easily digestible, and also provides you with vitamins and proteins that you need for healing, okay? So that's important too. Do not skip your dinner. The third thing is you're going to leave the office with a few medications. So I normally give you one antibiotic pill to take home with you. It should be in your bag when your post-op instructions. So that's one pill to take after dinner. So make sure you take that too. It's for prevention, okay? For our hair transplant procedures, I do not give long-term antibiotics. There's no need because the surgery here is all done under sterile conditions and everything is very clean, so the chance of infection is very low, but it's just a preventative. So take that pill after dinner. You'll also find in your bag some painkillers. Now, those are narcotics, okay? So be careful with them. Don't drive after you take them. Don't drink them with alcohol. And sometimes they can make you a little bit nauseous. So make sure you take them on a full stomach if you take them. So those are designed for you if you need it. Most of my patients, they take Tylenol or ibuprofen, Motrin, Advil. and those are okay. It'll say so in your instructions, and they can provide pretty good pain control. If you need something else a little stronger, then you can take one of those pills. You also left the office with a prescription for some extra painkillers. You don't need to fill that prescription, just have it with you. A lot of my patients come from far away, and so if you need more painkillers, you would have to come to the office to get another prescription, because I can't call in those things anymore. And so the prescription is for you in case you need it. If you don't need it, either burn it or shred it. In other words, just destroy it, and you probably don't need to take it. So the next thing I recommend you to do is for the first 3 or 4 nights to sleep elevated. So you don't need to sleep on a recliner. You don't need to sit up to sleep, but you want to put maybe 2 or 3 pillows behind your back. Make sure that your head is a little bit higher than your body. That's just to prevent swelling. Okay, it doesn't really affect the grafts, the transplants per se, but it's just to prevent swelling. Some people, probably 50% of the patients, will have some degree of edema or swelling in their forehead after surgery. It's highly variable. So we do some things here in the office during the procedure to prevent it, but some people may have it. So if you elevate yourself for the first 3 or 4 nights, it'll help you avoid it. Now the next day, you're going to wash your hair, right? There's going to be a separate video that I'm going to record here on the post-operative washing instructions, but I'm going to go through the basic principles here, and you have a separate handout on your instructions that deals with the shampoo. Most important things for the shampoo is start the following day after procedure, remove the bandage and the bandana, and then go and wash your hair. If you have a low pressure shower head, you can use that. If you don't, then get a bowl or a pitcher or a cup with you to the shower. You know, get the water normal shower temperature. It doesn't have to be super hot, doesn't have to be cold, just the normal temperature that you normally shower with. Fill that container, and you're going to dump the water really slowly on the transplanted areas. You don't want high water pressure hitting the grafts, because they can actually dislodge them and move them out of their little sockets. So be careful with the water pressure. Once you get your hair wet, you will get the shampoo that's in your kit that was recommended to you. You're going to put it on your hand. I'm going to put this here for a second. Put it on your hand, that small amount, lather it up, and then you're going to cup your hands like this, and you're just going to touch the transplants. Do not rub, do not massage for the first 5 days, okay? So just touch like this, push down. It's okay to put downward pressure, and then squeeze that shampoo in there. It's going to help you clean the transplant. It's going to help you decrease the scabbing, and is very good for prevention of infection as well. The donor zone, whether strip, FUT, or FUE, you can gently massage the donor zone. If you're hurting, you're doing it too strong, okay? So gently massage. Once you do that, then you rinse it off with the water again. And that's your shampoo, pretty simple. That technique should be used for 5 days. I recommend patients to at least shampoo it once a day, starting the day after the surgery. If you can or want to shampoo more than once a day, you're welcome to. When I had my transplants, I was shampooing it in the morning before going to work, at night before, or in the evening before, after I came from work, and before bed. So I was shampooing it 2 or 3 times a day, and I had very few scabs by the 5th or 6th day after surgery. So washing is good. It's going to feel good too, because sometimes you have a little itching here and there, and that's important because it helps you with the itching. If you're outside, now in Florida here is always warm, so if you sweat during the day, also it's a good thing to shampoo to get your scalp clean again. Sweating does not hurt anything, but you may want to clean once you get back home. Okay. Now, in your post-operative kit, you also find solutions that you should be spraying in the transplanted area and in the donor zone as well. So follow the instructions there. Basically, what you want to do is in between the shampoos, about every 1 or 2 hours during the day, during your waking hours, you might want to spray the grafts. You don't have to necessarily spray the donor, although that's a good idea too, but you have to spray the grafts. The idea is to keep them moist. When I did my original surgical training over almost 30 years ago now, we used to keep the wounds very dry. We used to put things to dry the wounds because we thought that promoted healing and decreased infection. Well, that has turned 180 degrees a few years ago where we now want to keep wounds moist because we know that it's easier for the cells to migrate through a moist wound and to heal it. So the sprays that you were given are designed to do that. So always keep the area glistening wet. It doesn't have to be dripping all over you, but it should be wet most of the time. So keep spraying that spray. Before bedtime, give it a good spray and go to sleep. You don't have to wake up at night to do it. It's okay to wear hats or baseball caps even the day after, but these hats have to be loose fitted. They cannot be touching anything or be very tight. So make sure you get a loose fitted hat or a baseball cap, and that way you can go to the drugstore or to the supermarket or whatever and people won't see anything that you have done. So it's okay to wear hats and caps, but make sure they're loose. So the next thing is, in your instruction package, you have my cell phone number. It's there for you to use it. So anytime you have a question, anytime you have a concern, text me. I prefer text messages because I tend to answer quicker. I can look at my phone and see that it's a text from a patient. So I tend to answer quicker. Phone calls, I mean, my phone, like most of us, right, it rings all day. So I just let the calls roll to voicemail. All my patients know to text me. So that's what you should do. You can text me pictures. I can answer to you what you should do, if that's normal or abnormal, so we can follow up with that. Don't be afraid to call me or text me. You're not going to be bothering me. I'd rather you do that than just, be wondering, and maybe it's something that we can easily fix or easily treat with a phone call, with a text, that you'll be wondering otherwise. So feel free to use my phone. We don't have an answering service at the office because all of my patients have the cell phone number, so it's there for you to use. Just text me if needed. If it's during Monday through Friday from 9 to 5, then I may not have my phone with me. I may be in the operating room, so call the office and they'll track me down and I'll call you and I'll come back to talk to you, okay? So what are the no's here? The big no's are, as I mentioned before, you don't want to scrub or rub these transplant areas for the first 5 days. Now, after 5 days, I'm actually in front of the thing here. So after 5 days, you can actually start gently massaging using the pads of your fingers, gently massaging the areas of the graft so that the scabs can fall out. It's okay to do that, and you're not going to hurt anything, but you should wait 5 days. Okay, the instructions will tell you that. Also, a big no is heavy exercises. It's okay to go out for a walk or go for a light bicycle ride or maybe a little bit of treadmill. The next couple of days following the procedure, that's okay. But heavy weightlifting, heavy cardio, no-nos, because they can increase your swelling. They can actually, you can actually hit your head on something and dislodge the grafts. You may have bleeding, all sorts of complications. So keep away from heavy exercises. I know it's difficult. I can't relate to that, obviously, because as you can see, I don't exercise very much. I should, but I don't. But anyway, I know a lot of you out there like to exercise, and it's hard to stay away from that. But just do something light for 5 days. It'll be actually for 7 days, I'm sorry. Do something light for the first 7 days. If you had FUE procedures, you can resume full physical activities in 7 days after surgery. If you had the strip surgery, you had stitches on your head, you do not want to do heavy physical activity for 14 days, okay? We need more time for that incision to heal. So if not, you run the risk of having problems there. So 7 days with no heavy exercises if you had FUE, 14 days with no heavy exercises if you had strip. Another question I get a lot too, particularly here in Florida, is swimming. When can I get in the pool or the ocean, right? The same thing applies here. You're gonna have little wounds in your head that are gonna be healing, so you don't want to expose them to chlorine water in the pool, irritant, or ocean water, which is not clean, obviously. So same thing as the exercise. In 7 days after FUE procedures, you can go swim, no problems. And then 14 days for FUT procedures, you can start swimming again with no issues. Okay, so just to recap, swimming and exercising 7 days after FUE is okay. 14 days after strip surgery, you can do that. Very simple instructions. You've made a decision to go to the transplant. Everything is going to grow well. We want the hairs to start growing and keep on going. It's going to take some time. As I told you before in the consultation, we're going to start seeing some growth in about 3 or 4 months, and you're going to see better growth at about 6 to 8 months, 12 months for your final results. So Time will go pretty fast, and I know it sounds like, well, I'm gonna have to wait to see the results. Yeah, but it'll get there pretty quick. If you follow all these instructions, if you call me or text me with any questions or concerns, this will go very smooth, and we're gonna be here for you all the way until we're gonna be high-fiving each other in 12 months, looking at the results and be happy with it, okay? So again, this is the instructions that we give our patients. So if you had surgery with me, follow these. Everything is in your post-operative kit in writing. So, and also my cell phone number once again. And if you had it by someone else, follow your doctor's instructions. I will see you next time with another video. In the meantime, take care.